Welcome to this Tutor to You Sociology topic video looking at sociological approaches to health, focusing on functionalism. Functionalism takes a positive view of society and believes that all social institutions perform valuable functions for the harmonious running of society, and they view healthcare and medical professionals as having positive impacts. One of the main functions of healthcare professionals is to monitor and administer the sick role to individuals, who are, to a certain extent, responsible for their own health and well-being within society. In identifying the sick role in society, the work of Parsons has been one of the more influential views of health. Parsons argues that when functioning normally, individuals have obligations and responsibilities to ensure that society is functioning correctly. However, when ill, individuals are allocated the sick role and excused from these obligations. They are able to be assigned the sick role through consultation with medical practitioners, and these grant individuals access to the sick role should they perceive somebody to be unwell and unable to perform their normal functions. When healthy, individuals have obligations: work, education, childcare, and serving their communities. But when they are ill, they are expected to fulfill the sick role, and they are excused from these obligations. This is often conditional, particularly in terms of longer-term illness, on the diagnosis of a trained medical professional. Doctors and other professionals will assign individuals the sick role if they believe that the individual is unable to adequately fulfill their obligations as a result of illness or injury. However, the patient must agree to try and get better. This may seem an obvious commitment, as most individuals want to be free of illness or injury, but a further condition is that they follow the advice of their medical professional in doing so. This includes taking certain medicines, undergoing surgery or other medical procedures, and also making themselves available for further consultation. In exchange, they are excused from social and occupational obligations, such as education and employment. The patient is expected to cooperate with doctors and other medical professionals during their illness, and this is monitored by medical professionals until they are satisfied that the patient is well enough to resume their normal obligations. Functionalists argue that it is important that medical professionals are trained to assess patients and act altruistically on behalf of their patients, that is, on the patient's best interest. However, other sociologists are critical of this altruism, with conflict theorists such as Marxists and feminists suggesting that doctors are often gatekeepers to the sick role, and that they are motivated by being part of the capitalist system and the patriarchy, and so fail to act altruistically with working class patients and female patients. Evidence of the sick role can be seen in employment in the UK, which demonstrates how influential Parsons' idea of the sick role is. When ill, most employees are able to self-certify their illness for a period of up to 5 days. Following this period, any further absence must be accompanied by a note from a medical professional stating the patient, the employee, is unfit to resume their normal duties, and this would ordinarily excuse them from work until such time as the doctor sees fit. When returning to work, employees are expected to bring a notice from their doctors stating they are fit to resume duties and obligations, although the extent to which this occurs is debatable. An employee being off sick has consequences for employers. Recent data from the Office for National Statistics has suggested that in 2021, almost 2.5 million people were on long-term sickness from work, an increase of over 500,000 since before the COVID-19 pandemic. This illustrates the extent of poor health on workers and how doctors facilitate the sick role in the UK. In evaluating Parsons' work on the sick role, it's important to note that other sociologists question the role of medical professionals and their motives. Some suggest doctors are employed by the ruling class and look to return workers as soon as possible, whilst feminists suggest that women's concerns are trivialised by doctors serving patriarchal institutions. The could also be argued over the extent to which employers honour the sick role and how employees, who cannot afford to assume the sick role, fail to release their obligations. Employees who do not receive sick pay or are self-employed are unable to take periods of paid leave and must work through illness. Furthermore, the increased medicalisation of society means that many individuals with mental health issues may not consider themselves to be healthy, yet will continue to work whilst on forms of medication to treat their respective illnesses. A CIPD survey in 2019 estimated that almost 80% of workers had carried on working whilst unwell, highlighting issues of presenteeism in the workforce, turning up to work but being unable to function adequately, which calls into question the extent to which the sick role is adhered to by both employees and employers. That concludes this Tutor to You Sociology topic video on sociological approaches to health, focusing on functionalism. Thanks for watching.